Good afternoon and welcome to 3 o'clock with SOC. I'm Marisol Diaz, Communications and Digital Manager. Give me a second while I welcome our Spanish-speaking neighbors. Buenas tardes, soy Marisol Díaz, gerente de comunicaciones digitales y bienvenidos a 3 en punto con SOC. Si quieren acceso al programa en español, favor de marcar el número que aparece en la pantalla, que es 646-749-3122 y cuando le contestan la llamada, marque la contraseña que es 779-328-221. Si quieren ver episodios pasados, los pueden buscar aquí en nuestro Facebook en la sección de videos y también en YouTube. All right, now I'll go ahead and pass it over to the moderator of the day who will introduce today's topic.
Hi everyone, my name is Marlene Zaran and I'm the Public Health Coordinator here at the Southside Organizing Center. I just want to reiterate that the translation information is in the comments section for you guys to find. You can definitely just go ahead and call 646-749-3122. And then you put in a code that is 779-328-221. So that being said, I just want to let everyone know that the videos that we broadcast on here and these lives will all be available for you guys to rewatch and watch in both English and Spanish on our Facebook and YouTube pages. So that being said, today I'd like to go ahead and introduce our topic. So it is the COVID-19 day, and I do have an important video that I'd like you all to watch that was just released as a live from the Department of Health Services with Governor Evers.
I'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us again today. So far, more than 245 million doses of the vaccine have been given across the nation, with more than 4.5 million of those doses right here in Wisconsin. Folks, this is really great news, and we're headed in the right direction, but I know we can do even better. Summer is right around the corner, and getting vaccinated will allow us to get back to all the gatherings and events we all miss safely. Whether it's a summer family reunion, a concert with your favorite band, 4th of July celebrations, or for me and Kathy, having a cream puff at the state fair, our ability to do so safely without masks and with all the fun we miss depends on as many people as possible getting vaccinated. Depends on you. More than 2 million Wisconsinites have completed their vaccine series. That's 2 million of your friends, family members, and neighbors, most with minimal side effects. And those side effects are a great sign that your body is building up protection and that the vaccine is working. For more than a century, we have used vaccines to protect from disease, and these COVID-19 vaccines have undergone and will continue to undergo the most intensive safety monitoring in U.S. history. So if you've been waiting to get your COVID-19 vaccine, it's a great time to do it right now. Any one of the approved COVID-19 vaccines is safe, effective, free, and it's the most valuable tool we have to save lives and stop the spread, and to ensure our state and our economy bounces back and better, and to get us back to what we were doing sooner. If you're an employer, help encourage your employees to get vaccinated by setting up a vaccination clinic at your business with the help of your local county health department. If you're headed out to get your vaccine, invite a friend or a loved one to come along. And if you're still considering it, head over to the CDC and DHS websites and learn more about how safe and effective these vaccines are, and then go get vaccinated. Even if you're young, even if you're healthy, even if you've already had COVID, go get vaccinated. Because I can't tell you how many times I've said it over the past year, but kicking this pandemic to the curb is going to take all of us together. Public health is a team sport, and we need you to help us get this done. Vaccine providers across the state have opened their doors to walk-in appointments, and many have appointments available. So head to vaccines.gov and find a COVID-19 vaccine near you, and don't forget to complete your vaccine series. Let's get vaccinated, Wisconsin, for each other, for our small businesses, for the future of our state, and let's get this done. With that, I will now hand things over to Deputy Secretary Julie Willems Van Dyke. Julie, it's all yours.
Well, thank you very much, Governor, and good afternoon, and thank you for joining us. So as of today, we have administered 4,751,017 doses of COVID-19 vaccine in our state. As the Governor said, 2,265,706 Wisconsin residents have completed their vaccine series. We're making progress, and every dose administered moves us further down the road to the other side of this pandemic. Of course, the more people eligible for vaccine, the more progress we can make, and that is why we are all eagerly awaiting the outcome of this afternoon's meeting of the Advisory Committee on Immunization Practice, a group of independent experts who advise the CDC on vaccine recommendations. The Food and Drug Administration expanded the emergency use authorization for the Pfizer vaccine on Monday to include children ages 12 to 15. And the ACIP is currently meeting to issue the clinical guidelines for this expansion. As soon as ACIP releases their guidelines, DHS will be ready. If the guidelines are as simple as an expansion of the age range, then we will update the standing order tonight, and vaccinations can begin tomorrow. If the guidelines contain additional clinical considerations that are unique to this new age group, we'll be ready to move forward as soon as they are released in the MMWR, or the Morbidity and Mortality Weekly Report, which will come out later this week. This decision might come as we are briefing you. Either way, the most important information to share right now is this. Trials show that the Pfizer vaccine is 100% effective in preventing infection in children aged 12 to 15. And that is very, very good news, especially since we have seen an increase in cases among children recently. Vaccinating children in this age group will prevent individual illness and help stop the spread among our children and in our communities. For the parents and guardians out there, now is the time to start planning how to get your 12, 13, 14, 15, 16, and 17-year-olds vaccinated. There are a few things to keep in mind. Some are the same as every vaccination for your child, and others are more specific to COVID-19. Just like with all vaccinations in Wisconsin, your child will need parental or guardian consent to get the COVID-19 vaccine. And just like with all your vaccinations, your child's pediatrician is a great source of information if you have any questions or concerns. Only the Pfizer vaccine is authorized for this age group. So Vaccine Finder, which has a new and even easier to remember website now, vaccines.gov, is a great tool to help you find it. Again, that's go to vaccines.gov, click Find COVID-19 Vaccines, and then filter your search to include only the Pfizer vaccine before you enter your zip code. Our vaccine hotline can also help you find an appointment at 1-844-684-1064, 1-844-684-1064. DHS.wisconsin.gov/vaccine has a wealth of information about vaccine safety and efficacy. what you should expect during your appointment and after your shot, and links to our vaccine data page. Our team is working on fact sheets for parents even as we speak, and those will be uploaded as soon as we hear more details from ACIP. As we continue our vaccination effort, we also need to remember that COVID-19 is still present and spreading in Wisconsin, and that we all need to do our part to stop it in its tracks. That means getting vaccinated, washing our hands, wearing a mask, and physically distancing. Today, we are adding 558 new confirmed cases, which brings our total confirmed cases of COVID-19 to 604,378 people. Our 7-day average of new cases is 491. As of today, we have lost 6,935 Wisconsin residents to COVID-19. Our thoughts go out to their families and friends as we all recommit to doing everything we can to stop the spread. And with that, I'll turn it back to Jennifer for your questions.
Thank you. And a reminder to maintain audio quality. Please keep your phones on mute until it is time to ask your question. A note that we do need to conclude the briefing at 2:15 this afternoon, so in the interest of time, please one question per reporter. And we'll begin this afternoon with Kent Wayne Scott from WISN TV in Milwaukee. Kent?
Good afternoon. Thanks for taking my call. I just am curious about the rate of vaccinations. You talked about the number that have been vaccinated, but we've seen pop-up and mobile clinics, outreach into communities, and still a large number of people remain unvaccinated, and the rate seems to be leveling off. So are any new approaches being considered to boost those numbers, things that haven't been done yet? And once younger people have access to the vaccine, do you anticipate that rate of vaccination being any higher than what we've seen so far with the older population?
Well, it's always hard to predict what will happen in the future. But we always hope that the rate of vaccine for each group will get higher and higher. You know, I think it's important to remember as we look at the pace of vaccination getting a bit slower is the rapid pace which we've had up until this point. And it's been much quicker and much faster than I think any of us could have anticipated. And so now, as we say, the hard part begins, which is we find a lot of different creative ways to do pop-up clinics, to bring vaccine to where people are at, to have more conversations with folks who are still making up their mind about vaccine. And that just means we have to do it for more days and fewer people per day. And, you know, if you think about it, if you're going to do a pop-up clinic in a grocery store, or as I heard today in Eau Claire, at a bar, or at a neighborhood center, you're probably going to see, 50, 100 people. And compare that to some of our mass vaccination clinic sites and some of our health systems that we're doing 1,000, even 2,000 doses a day. It's going to take us longer to get there with those smaller sites. But this is a long journey, and we'll continue to make progress one step at a time. And we're really eager to invite the 12 to 15-year-olds into this fold. And if 12 to 15-year-olds' parents haven't gotten vaccinated, great time to make this a family event and have everyone get vaccinated together.
All right. So that was the update. So that was a couple hours ago, and then there was another media briefing, and it fully officialized that 12 to 15-year-old children can now get their COVID vaccine, right? So I'm just going to share my screen and show you guys the official document, and we'll put that also in the comment section for you guys to read as well. So if you look at this screen, this was released by the Department of Health Services today, about an hour ago. So it states that 12 children, 12 to 15-year-olds are now eligible to receive the Pfizer COVID-19 vaccine, and vaccinations can begin starting Thursday, May 13th, which is today. The Pfizer COVID vaccine is the one that they require for full protection of this age group. And then it also states that parents and guardians of these children can schedule a vaccination using a variety of options, including their healthcare provider, at community-based vaccination clinics, local and tribal health departments, or pharmacies. To locate a provider administering the Pfizer vaccine, visit vaccines.com. So you can go to vaccines.com. We have that for you guys as well to put in the comment section. And then parents and guardians can learn more by visiting the COVID Resources for Parents and Guardians page, or by calling this phone number, 1-844-684-1064. And it's toll free. So I'm going to show you guys, I'm going to stop sharing this screen, and I'm going to share a different screen that is going to explain, it's going to show how to find the closest vaccination clinic near you. So this is the website. So you're going to go to vaccines.gov, and it's going to take you right to here. And this is through the CDC. So this is a large map, and it's going to show you where the closest location is to you. So let's pretend that I am a mom of a 12-year-old and I want to get my kid vaccinated. So I'm going to go on this website, and I'm going to unclick the Johnson & Johnson and the Moderna, because the only one that 12 to 15-year-olds can get is the Pfizer vaccine. I'm going to change the search radius because I don't want to drive 25 miles. I'm going to put it at 5 miles near my house. And I'm going to put the zip code. So we're going to put 53204 because that's one of the zip codes that SOC serves. So search for vaccines. So it shows me here all of the different locations that are near my zip code. So the first one that pops up that has vaccines in stock is the Aurora Administrative Office, which is at West Virginia Street. And then you have the Walgreens Company on West Wisconsin Avenue. You have the FEMA Wisconsin Center on 400 West Wisconsin Avenue as well. You have Metro Market Pharmacy on North Van Buren. You'll see here this Aurora Sinai Medical Center. They're out of stock for vaccines, so you skip that. So it gives you all of these different options. And then you can pick the one that you feel you can go to, right? So like even the FEMA Southside Health Center, they're out of stock right now, so they'll probably have to restock tomorrow. I personally, I'm looking at this, I think the one that I would go to is most likely this Life Change Pharmacy on South 15th Street, which is close to where I live. So I'm going to click that, and then it's going to take me here. And then what I can do is I can call the location and have them set me up and schedule me. And when you scroll down, it'll give you all of their hours of operation. So this facility is open Monday to Saturday, 10 a.m. to 4:30, which is very convenient. And then it has all the vaccines, but it's good because it has the Pfizer vaccine. So your child that's 12 to 15 can go get vaccinated. And you can call them at this number, 414-999-0999. And this is their address, right? So that's how it would work. You would call them, and then you'd set up an appointment. Yeah, and then you can go get scheduled to come in. You do not need to bring an ID of any sort. When you are getting vaccinated, you will most likely provide your name and your address, and that's it. and then you will get vaccinated. And then they'll give you your vaccination card that shows like your first vaccine dose. And then you'll be automatically scheduled at that location for your second vaccine in 2 weeks. So that's how it works. Very easy, very simple. And yeah. So that being said, I did watch another briefing today by Fox 6 News, actually about 30 minutes ago. And Mayor Tom Barrett and the Commissioner of the Public Health Department stated that Children's Hospital will be reaching out to children that are in the 12 to 15-year-old age group. So if you have a child that is that age and they have gone to Children's Hospital, or they're a current patient of Children's Hospital and that's where you go to get their medical help, they'll reach out to you and they'll be asking if you would like to schedule to vaccinate your child. And even if you're not a patient of theirs, you can go get your child vaccinated there. They also stated that they will also be opening up clinics all over the state. So these will be pop-up clinics by Children's Hospital all over the state, so the 12 to 15-year-old children can get their COVID vaccine. Symptoms that have been reported are very common, such as a sore arm, low fever, and body aches. There were about 4,000 of these children in a study with the CDC to see how they would react to the Pfizer vaccine. 2,000 of them were individuals that received the COVID vaccine, and the other 2,000 was a placebo. So what a placebo means is they just inject you with like a saline solution that is just sugar and water, and it doesn't have an effect, right? But the only reason to do that is scientific studies do that, so it doesn't cause any type of bias when they're looking at the data, right? Because some individuals, sometimes they might go to a study and take a pill, and then your mind can sometimes play games on you, start thinking that you have certain symptoms, but you don't. So this way, this keeps everything consistent in gathering and controlling the data. So if you do have questions about that, you can visit childrenswisconsin.org/coronavirus. They will have more information about that for you all and more information for parents. We also have a link for you guys if you need some more guidance of if you should get your child vaccinated. It is recommended to get your child vaccinated during this time because they will be starting to go back to school. And according to the Public Health Department, children's rates for COVID vaccines, children's rates for having COVID has increased in hospitalizations since a couple of months ago. It has decreased this past week, but it's been an ongoing increase. And it's now the target population for the Public Health Department. So we try to decrease COVID cases because children will start to go back to school and to other activities, and we want to make sure that they're perfectly safe. I do recommend that you do go get your COVID vaccine if you have had COVID. If you haven't had COVID, even if you are staying home and working all the time, go get your COVID vaccine. It'll help you in the end, and it'll make it safer for you even if you get COVID. There's a 100% rate that even if you do get COVID, and you've been vaccinated, it'll decrease 100% chance of death and further COVID-19 complications. So get it, not for others, get it for yourself. You care about yourself. Do it for you. Do it for your health. So that being said, let me move on to the next topic that I wanted to talk about today, which was the CDC website. Okay, so let's talk about the CDC website. I'm going to share my screen now, and I'm going to show you how to navigate the CDC website. I acknowledge I probably should have done this a while ago, but here we go, learning something new. So this is the cdc.gov main page. If you go to cdc.gov, this is what's going to pop up. It's going to show you all of this information. Like, you can click here to see information about after you've been fully vaccinated, or vaccines for children and teens, or COVID-19 testing, right? You'll go down here. You can see a lot of different dates that they have here, which is the Pfizer vaccine in adolescent age 12 and older. You can click on this to see that news briefing. You can go down here, CDC in action. You can see how they've been responding to the COVID pandemic, podcast, library, lab safety, all of that. Okay, but the one important thing I want to go over is COVID-19. So what you're going to do is you're going to go to diseases and conditions, and you're going to click on this tab, and you're going to go to coronavirus disease, and it's going to take you to this page. We do not want to give feedback. So here's a section about being fully vaccinated. So how you can resume activities that you did prior to the pandemic once you're fully vaccinated. You can learn more about that. You can go to here. These are the top highlights that have been streaming on the page. Vaccines for children and teens, how to find a COVID vaccine, who should be tested for COVID, and variants. Variants essentially stands for any mutations that the COVID virus has been enduring. The reason why we advocate for individuals to get fully vaccinated is it decreases the chances of people getting COVID. The less people that get COVID, the less likely the virus will get stronger and have these different DNA mutations. So the less people that get it, the less the COVID variants will increase. And that means the more likely chance we will not be seeing different types of coronavirus mutations coming up, and we will see a decrease in COVID numbers, and we can go back to normalcy. Hopefully, that will happen very soon. So yeah, and then when you go down here, the COVID vaccines, more information, symptoms and testing after your vaccine, quarantine. This shows you cases. So in the US, there's been a total of 32,608,287 people that have gotten COVID. There has been 264 million individuals that have gotten their COVID vaccines. And there's been a total of 580,073 total deaths in the US because of COVID. That's almost 1 million deaths because of COVID, which is really sad. If you look back historically, there was something called the Spanish flu in the 1920s. And essentially what that virus hit the United States pretty hard. It hit the whole world pretty hard. But millions of people died during the Spanish flu pandemic, and individuals quarantined for 2 years until things came back to normal. So if they can do it, you guys, during the 1920s, where they literally had no technology and they were in their homes all the time, then we can do it too during this time. So another quick update I'd like to quickly give you guys is it was actually released earlier this morning that we are transitioning into phase 6 now. So what does that mean, Marlene? I'll tell you what it means. It means that there's going to be limits on gathering sizes and occupancy will be lifted for businesses and events hosted after June 15th will not need to submit a COVID-19 safety plan to the city health department. So essentially and transitioning into phase 6, there's going to be changes in the amount of people that can gather in certain facilities and events, and that will be lifted June 15th. The Milwaukee Health Commissioner, Kirsten Johnson, stated this earlier today from the City Health Department. And she also stated that officials will continue to recommend physical distancing whenever possible. Mask wearing will still be reinforced indoors, and the department will follow guidelines from the U.S. Center for Disease Control and Prevention for outdoor spaces. They are currently deciding right now, since the CDC did just release some information, that they stated that you will most likely not need to wear a mask if you are outdoors. They are going to be reviewing that for the city of Milwaukee. The CDC recommends these things, but it is up to our local, state, and local and state officials to give things that are policies that are recommended and policies that are definitely in place. So, yeah, there will be lots of different changes coming up in the next few weeks, and I will try my best to keep you all updated. That being said, let me move on to our next part, which is I'm going to tell you who's coming on tomorrow for the forum. So tomorrow we have Jeanne Geraci. She is from Empire and the Benedict Center Services. She's the executive director of Benedict Center. So she's going to be coming on. And yeah, I hope you guys follow all of this information. The link to the full COVID-19 media briefing can be found in the comment section as well. It's on YouTube. You can go follow the Department of Health Services YouTube page. You can get all your information that way as well. They also stream it live through their Facebook. So if you go like their Facebook page, and if you go like Fox 6 News' Facebook page for Milwaukee, they broadcast things live with updates 24/7. Whenever things are available, they go on and stream it live. We have a link in there for you guys on information for 12 to 15-year-olds getting vaccinated. You can now go get vaccinated for your children. You can get your children vaccinated, I mean. The health commissioner's child got vaccinated today. And she stated he was pretty good. You can go get your vaccine as well at Hayat Pharmacy, the COVID-19 testing center. And we have that link in there for you. If you have questions about COVID for the COVID crisis line, call 211 or call 1-877-947-2211 for more information on COVID. Or if you call 211, they will help you, guide you in the closest location for COVID vaccines to your home. And that being said, my friends, I'd like to conclude and wish you all a happy Thursday. And I will see you guys tomorrow because I'm producing tomorrow. But here is a quick survey promo. Have a good day.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.